Health Matters on SAFM.
Well, I'm joined in studio now by Dr. Maureen Allem, and she's regarded as one of the top cosmetic doctors in South Africa. And this evening, we're going to be chatting about the increasing, if there is, obsession with aging and also the psychology of aging. Good evening, Dr. Allem. Welcome to the show.
Hi, Karen. Thanks for having me.
So let's talk about this obsession with aging. Is there an obsession with aging? We seem to be living longer, so I'm assuming that the older we get, because I think in days gone by, people didn't get quite as old as we're getting now.
No, absolutely. I mean, women live to a ripe old age of 80. I mean, that's very easily to come by, but it's not really an obsession. It's just that all these non-surgical procedures are more accessible to the average person. You know, before, women couldn't do much about their aging face. Either they went for surgery, which involved a general anaesthetic, being off work for 2 or 3 weeks. But now, for all these non-surgical procedures like Botox and fillers and lasers and skin tightening procedures, we can actually, do a quick procedure. Can be a lunchtime procedure. You might have a few bruises that you might have to expand away, but you can actually go back to work and carry on with your life. So that's why I wouldn't call it an obsession. I mean, we have many patients and not many of them obsessed. Most of them are just normal, average working women, actually very successful working women who just want to look better in the workplace and want to just give a better appearance to the people they work with. Very often I asked the one woman today, why is she here? And she says, I'm a psychologist and I have many depressed patients and they come to me for therapy and they keep asking me, why do I look so sad? And why, because I'm the person supposed to be giving them the therapy and I'm the one that's looking angry and sad because she had a very downturned mouth, just part of the whole aging process. I mean, that's what happens. You lose volume, you lose collagen, and then your whole mouth starts to turn downwards. And she also had a very cross, very strong frown line. So she said, what can you do to help? Because I want to appear better for my patients. Because it's not good that I look sad, and I'm not a sad person. So she was just one of the patients that I had today, because I was asking my patients, why are you actually coming here today? Why do you do these things? And they actually do it for themselves, because they wake up, they look at themselves in the morning, and they see that they're getting old, and they don't, now that there's hope with all these non-surgical procedures. But you have to make sure that you don't, overpromise and underdeliver with these patients.
Do you find that people become obsessed by this? If they go for it once and think this is great, or maybe I'll have something else done now. Is that a very small percentage of people?
No, it's a very small percentage. We have maybe 8 patients in our whole practice that are actually quite obsessed with what they look like. They'll come there every 2-3 weeks and have something done. But most people come back every 4, 5, 6 months, do the little bit of Botox, because it is quite amazing what the Botox does. Once you've had a Botox injection, then my patients ask me, now, doctor, when must I come back again? And I say, when you stop receiving compliments again, because it's amazing. You do the Botox, a week later, your whole face just takes on a different appearance. Your eyebrows get raised, you have this fresh look, and people start saying, did you sleep well? Have you been on holiday? So they can't quite pinpoint it. But people who've had Botox know exactly, because they know that exact look. Your whole look looks different. And then, it stays there for 3, 4, 5 months, and eventually those, it goes back to the same point where it was before. Never ever gets worse, can actually only get better. And that's when they come back. They say, no, you're right, my compliments, I need more compliments. It boosts them. So, so it's great. If you can do small things, why not? If you can do more small things to make yourself look a bit better and more approachable.
I remember many, many years ago, when the very first time I ever heard about Botox was they were using it for children, I think, with cerebral palsy, sort of their hands become clenched and they could actually release the fingers by injecting them with Botox. Absolutely. And then suddenly I heard, they're using it in people's faces. But it also has medical applications. I mean, for people that grind their teeth, that I think it's bruxism.
Oh, it's too
you can
numerous
actually
to
help
mention.
with that.
You
It's not just for, looking good.
That is an amazing treatment. You can't believe how that changes people's lives. I mean, this one woman vowed she would never ever do Botox, and her husband actually forbid her to do Botox. And she had such bad bruxism, she was clenching her teeth so badly that she was actually desperate. She says, I can't actually face another day. And her husband happened to be watching some popular program, Dr. 90210, it's called. And he said, oh my goodness, look, they're giving Botox for your problem. And he actually, forbidding her, he actually brought her and they said, please, can you help my wife? And it was quite amazing. And then I had another woman, she couldn't open her jaw. She'd been suffering for months. And she read about the Botox and she researched and she came into me and said, look, I can't promise you, but, it does help. And she says, doctor, within 4 days, I was already starting to open my mouth. And she came to me a month later, because it takes about a month to work. Because those muscles, those grinding muscles are quite large. So it takes a month to work to relax those muscles. And she's, look, doctor, and she had her mouth wide open. Look, I'm a different person. It's quite amazing. And then you also have the patients who sweat a lot under their arms. they have
hyperhidrosis
or axillary hyperhidrosis, and that's also life-changing for them, because a lot of them are, out there giving presentations, and they're too embarrassed to stand up there because they're drenched with sweat, and it only really comes when you're stressed. They can run a mile and they won't perspire, but just put them in a stressful situation, and it pours, and that makes such a huge difference to them. I mean, some women are totally upset with what they're going to wear because they've got such a problem with hyperhidrosis. And it's life-changing for them. They say, you don't understand, I can actually go out now and just look at all the clothes and not just a certain...
How often would they have to come back for something like that?
About, it depends, every 6 to 8, 9 months.
Oh gosh, that is quite a long time in between.
It works much longer for hyperhidrosis. And for migraines, I've had, I had a radiologist, he's been now the 3rd time. He says for 30 years he's had this most terrible migraine, he's been everywhere. And he's tried the bite plates. Eventually he saw some article in one of his medical emails about how Botox, and he researched it, and he says, please, he's now desperate, he's desperate to do anything. And he says it was the best money he's ever spent. He said he's been headache-free. Because
it's relaxing the muscles.
Not headache-free, but he gets so few headaches now. So it's completely... We're not quite sure how Botox for migraines works. They say it's related to some neuropeptide in the brain that it blocks that neuropeptide that causes pain, or it's just the release of that tension headache. And very often he had very pain behind his neck, and he said, and they say inject, basically follow the pain. So it actually points out to me where his tension's coming from. You put a few units of Botox there, and a few days later it all starts easing up. So, as I say, never mind looking better, you can actually feel better,
So when we talk about cosmetic doctors and what you're doing, which is most of it's non-surgical effectively, it's not just all about, the crow's feet and the lines on the face. There's so many other applications of what cosmetic doctors do.
It's a completely holistic approach. We do a lot of acne, patients who are desperate with their acne, patients who've got, hormonal pigmentation is a big problem. I'm sure you see women who, fall pregnant and then all the hormones change, and then they develop this, quite severe mask on their face. I mean, that's such a common problem. Like 1 in 3 of our patients who come in, they've actually got a hormonal pigmentation problem. And it affects all races. And it seems to start, for women from the age of 30, they start getting these dark. And they say, doctor, my face feels dirty. Please, can't you help me get this, this pigmentation off my face? So we have to explain to them how it works and what feeds it, like, being on the pill, the oral contraceptive feeds this pigmentation. You have to avoid the sun. And this is a dynamic condition which you have to manage forever almost. Because as soon as you go, you finished your normal womanhood, you go through menopause, and then you start with hormonal replacement. So once again, you're now feeding your problem, feeding the cells that make pigment. So you have to explain to them, how to manage this. And
tough life being a woman, Hem.
It's exhausting. I mean, it's not one thing, it's the other.
So the whole psychology behind all of this, it's really, I asked you, I think, before we came on air, whether women are doing this for themselves or whether they're doing it because they feel they need to do it for somebody else.
No, absolutely. No, they're doing it for themselves. I mean, we've got to, wake up in the morning and have a look at our faces in the mirror and see what's happening to our faces. And, when you're having a bad hair day, what do? You go fix your hair up, and then you walk out there, you've had a little bit of a blow wave and a wash and blow, and you feel amazing. So why not? Why can't you fix your face up as well?
And just to reiterate as well, we mentioned it earlier, I think, if you start doing this and at some point you decide you actually can't carry on with it, your whole face isn't going to collapse.
No, absolutely not. I've been doing Botox for 10 years and I'm certainly not collapsed. My face certainly hasn't collapsed. They've actually done clinical trials where they've done biopsies after 12 years. And they've found that there is always re-innovation. That nerve will always grow back. Because what happens, you relax that muscle by relaxing that nerve. And then that muscle is very clever, it sends out another little nerve endpoint. And so there's always re-innovation. And if you start early enough, like in your 30s, you can actually prevent that brow droop that occurs and the jowl droop. Because you've noticed, like some older women, they get the stringy neck. And all that is that band of platysmal muscles putting the whole jowls down. So if you can, keep the playing field level, because you have muscles that pull down and muscles that pull up, both in the jowl area and the brow area. So if you can keep that playing field level, you don't get the hectic sagging that occurs with age. Drooping with age.
The other thing as well, you mentioned to me also before we came on air, that it's a holistic approach. So it's diet and what you eat, and it's
absolutely
the gymming thing, and it's not just about rushing off and getting the Botox. You also have to put some effort into it rather than just walking into your surgery.
Like the smoking, trying to get the women to try and stop smoking, because you have no idea how smoking affects the skin. I mean, you totally asphyxiate your skin when you're smoking. So we try, try and encourage them to stop smoking and weight. I mean, the biggest thing, like we have these larger women coming in, and I tell you, if you don't lose the weight, you're never going to look great. So we try also get them to lose a bit of weight, which is, so great for their health. Because the big problem, diabetes and hypertension as you get older. So
it's very, as you say, very much a
we
holistic approach.
We don't only do the face, we actually do their bodies as well and get them down to a more healthy weight.
Gosh, well, it's a whole new light now for me on cosmetic surgery. I thought we all rushed off and had operations and things, but it's not like that anymore. It's all changed.
Look, if you leave it late enough, then you're going to have to go have plastic surgery. If your jowls are hanging and you've got a lot of excess skin, you're going to have to cut that away. But as I explained to a woman today, so either you cut it away, you take it to a tailor and you cut it away, or you go put it in the washing dry and you shrink it. So that's what we do. We shrink your skin. We try to shrink it back.
It just sounds a whole lot easier and a lot less effort too. I mean, it's not as and you said it's so much quicker. I mean, it's your lunchtime. Look, you can pop in and look good.
You've got the few more expensive treatments, which obviously not everybody can afford, but there are small little treatments that most people can afford. The most working women can afford.
Well, it sounds like a whole new thing to think about now. It's not quite as traumatic, I think, as I always thought it was, and it's very simple. So I'm really grateful to you for joining me this evening. Thank you very much.
Okay, thanks, Karen. Thanks for
I was
me.
talking this evening to Dr. Maureen Allem, and she, as I said in the beginning, is regarded as one of the top cosmetic doctors in South Africa. And if you were wanting to think about having some Botox treatment, and as I said, not just for your skin and not just to look good, but it's also very good for certain medical conditions. So have a look on the internet. I'm sure you'll find lots of information on what to do. And Dr. Maureen Allem, again, thank you very much for joining me this evening.